Behold these haunting images. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Not merely scars, but cautionary tales etched into flesh. Scars not merely physical, but deeply emotional. Each scar a testament to the perils of overzealous ambition and the irreversible consequences of misjudged surgical interventions. These are not just remnants of past procedures. They are stark reminders of the fine line between restoration and ruin. With my background, with my training in plastic and reconstructive surgery, I can attest that regardless of whether it's an FUT procedure or an FUE procedure, donor area scarring remains a significant concern in hair restoration surgery. My training as a plastic surgeon has endowed me with a nuanced understanding, like all other plastic surgeons, of wound healing processes, enabling me to anticipate and manage the complexities associated with surgical scars. Despite advancements in surgical techniques, the unpredictability of scarring, especially with the FUT method, persists, and this necessitates a comprehensive understanding of management strategies available. And that's what we're going to discuss today. Now, one by one, I will discuss visual narratives so you can understand the gravity of the case, each case that I bring forth to you, so that you can discern the boundaries of surgical intervention. For in acknowledging the limitations, we underscore the paramount importance of prevention, of meticulous planning, and the judicious application of surgical expertise. Now, this is a 35-year-old male who underwent an FUE procedure during which over 5,000 grafts were extracted in one go. Now, 1 year later, he has a moth-eaten appearance of the donor, characterized by patchy bald spots and extensive scarring. The overzealous extraction not only depleted the donor supply, but also compromised the scalp's vascularity or blood supply, the scalp's integrity, rendering the area unsuitable for future harvesting as baldness progresses. And despite attempts at camouflage, many attempts, using various methodologies, including SMP, the unnatural appearance persisted, leading to significant psychological distress to the patient. And the second case we have here is a 42-year-old who underwent an FUT procedure, several FUT procedures in fact, over a span of 5 years, and each procedure involved the excision of a linear strip, cumulatively resulting in a wide hypertrophic scar. The repeated surgeries, misguided surgeries, failed to account for the diminishing elasticity of the scalp, leading to wound tension and poor healing outcomes. The resultant scar was not only cosmetically unappealing, but also symptomatic of the tissue's compromised state, and this precluded further surgical intervention. In case 3, we have a 38-year-old male who underwent an FUT procedure to address his receding hairline. The surgery involved the excision of a linear strip from the occipital region, as is normally done, followed by a trichophytic closure, much touted trichophytic closure, a method designed to minimize scarring by allowing hair to grow through the scar line, thereby hiding the scar. But it was not to be. In the immediate post-operative period, the patient adhered to all post-operative care diligently. However, as weeks passed into months, an unsettling development emerged. Instead of the anticipated thin, inconspicuous line that was promised to him, the scar evolved into a prominent raised formation, as you can see, colloquially termed as a smiling scar due to its curved appearance. This hypertrophic scar stood elevated above the surrounding scalp, starkly contrasting with the patient's natural skin tone, rendering it visible from even a distance. A little bit about hypertrophic scars. They are characterized by excessive collagen formation during the wound healing process. And this leads to raised, thickened scars that remain confined within the boundaries of the incision line. Factors contributing to such scarring include tension on the wound edges, individual genetic predispositions, and the anatomical location of the scar line. In this patient's case, the occipital region's inherent tension and his unique healing response culminated in this pronounced scar formation, and the psychological impact was profound. The patient reported heightened self-consciousness, avoiding short hairstyles, avoiding social situations where the scar might be exposed. Many attempts at camouflage, including hairstyling, including topical skin painting, proved futile. The scar's prominence served as a constant reminder of the procedure, overshadowing the benefits of hair restoration surgery, putting the procedure and surgeons who practice this procedure into disrepute. Another case you have, case 4. And yet another, case 5. One more, case 6. Yet another, case 7. And that's not all, there are many more in my library. FUT involves excising a strip of scalp tissue from the donor area, typically the occipital region, resulting in a linear scar. The visibility and width of the scar can vary significantly among patients due to factors such as individual healing responses, skin elasticity, and surgical technique being used in the expertise of the doctor. Even with the most meticulous procedure, even the trichophytic closure, done by the best of surgeons, the outcomes remain unpredictable. Factors like scalp tension, individual healing variability, and the potential for hypertrophic scar formation contribute to this unpredictability. Consequently, many patients prefer FUE over FUT, as FUE tends to result in less noticeable scarring, especially for those who wish to wear the hair shorter. And moreover, even if FUE scars have to happen, they are generally easier to manage, easier to conceal, compared to the linear scars, the unpredictable linear scars of FUT. Now let us deal with FUT and FUE scars individually. Management of hypertrophic scars involves a multifaceted approach. Initial interventions may involve intralesional injections of Kinocort to reduce the inflammation, to reduce the collagen formation. Additionally, silicone gel placement and pressure therapy are non-invasive methods to flatten the scar over a period of time. However, in refractory cases in which scars do not settle down with time and with these non-invasive treatments, surgical scar revision might be considered. However, when you opt for surgical scar revision, you have to be careful that it does not recur and there is no further scarring. And now we discuss W-plasty technique, a trademark technique at my clinic, which I've been doing for now 20 years, revising FUT scars with it. This surgical method involves Z-plasty, creating a zigzag incision pattern to break up the linear scar and make the scar less visible to the eye. The visibility of the scar is improved by disintegrating the scar into short segments that are less visible. And here is how I do it. And then we come to follicular unit grafting. Transplanting beard hair grafts, since they're thicker, 3 times thicker than scalp hair, provide a better illusion of coverage of the scar. But one thing has to be noted, that graft survival in the midst of dense scar is unpredictable. But if certain tenets of surgical technique are followed, grafts can survive in FUT scars. And then we have the combination technique, W-plasty or Z-plasty with FUE grafting, combining surgical scar excision with FUE grafting. And this can enhance outcomes, not done at the same time, but in a gap of 18 months. And this approach aims to reduce the scar width and improve hair density within the scar. FUE entails extracting individual hair follicles and leaving behind tiny circular scars, pale in nature, often referred to as white dots. Although less conspicuous than FUT scars, which are linear in nature, these dots can become noticeable in darker skin types, and especially when the hair is cut short. Factors that influence the visibility of FUE scars include punch size, extraction technique, type of mortar used, and of course, individual healing characteristics. The donor area is often regarded as a sacrosanct reservoir, a finite resource that once depleted offers no second chances. Yet in the pursuit of immediate results, or due to inadequate surgical planning or technique, this vital area can be irreparably compromised, leading to outcomes which are aesthetically and psychologically devastating. Whatever you do, the pale scar of FUT or FUE will not go away in entirety. 40% of visibility will still remain after exhausting all surgical techniques to minimize scarring, like W-plasty or grafting. And this is because we are merely placing grafts in the center of the pale scar in FUE, but the paleness will go away by only adding pigment. And this is where SMP helps, and it involves tattooing pigment into the scar to mimic the presence of hair follicles. And this effectively camouflages scars. While it doesn't restore hair, it can significantly reduce the visual impact of scarring. Besides SMP, many people choose laser therapy to reduce the scars. Laser treatments like fractional laser therapy, carbon dioxide laser, can improve the texture and the pigmentation of FUE scars, thereby making them less noticeable. Because these treatments stimulate collagen production and assist in skin remodeling. And then we have certain topical treatments. Topical treatments like silicone gel, corticosteroid cream can aid in scar maturation and reduce the visibility, although results may vary and are not as effective as surgical methods. FUE grafting is often requested by patients who have donor areas which are severely depleted, but in such cases you have to be very sure that the patient's baldness is not going to progress any further. He does not have a very strong family history of baldness. Only select cases can be offered FUE grafting into over-harvested scalp donors, and this is how I do it. So to end, both FUT and FUE carry a risk of donor area scarring with varying degrees of visibility and patient concern, while surgical and non-surgical methods can mitigate the appearance of these scars to some extent. Complete elimination of scars is unattainable. A tailored approach considering individual patient factors and preferences is essential in managing donor area scarring effectively. And as the adage goes, an ounce of prevention is worth a pound of cure. Thus, meticulous surgical planning, proper case selection, proper selection of technique, and patient education remain paramount in minimizing scarring risks. Overharvesting occurs when an excessive number of follicular units are harvested from the donor area, surpassing the safe threshold and leading to visible thinning, scarring, and in severe cases, complete baldness in the donor zone. This appearance is not merely a cosmetic concern. It signifies permanent loss of a viable donor, effectively shutting the door on future restorative procedures as baldness progresses. The consequences are particularly dire when overharvesting is coupled with poor surgical technique, resulting in confluent scarring that obliterates the natural architecture of the scalp, the integrity of the scalp. And once the donor area is overharvested and scarred, the options for remediation are severely limited. Alternative donor sites, such as beard hair, chest hair, hair from other sites, often differ in texture and growth patterns, making them suboptimal substitutes. Moreover, the use of these areas is constrained by their own limited supply and potential for visible scarring. Scalp micropigmentation can offer a semblance of density, but fails to restore the tactile and dynamic qualities of natural hair. In essence, the bridges have been burnt, and the path to recovery is obstructed. The allure of immediate transformation should not eclipse the necessity for sustainable and responsible surgical practices. The donor area, once compromised, offers no recourse, and the resultant scarring serves as a permanent testament to the consequences of imprudence in hair restoration surgery. As stewards of this delicate balance between restoration and preservation, it is incumbent upon the surgeons, and at times the patients themselves, to approach hair restoration with the gravity and foresight it demands. So thank you for watching. If you have any questions about this talk, about revision hair transplants, about hair transplants gone wrong, about scarring post hair transplant, do let me know. Leave a comment in the comment section below and I'll get back to you. If you want a personalized consultation, please contact us on the numbers on WhatsApp given above and we'll get back to you shortly. Have a nice day and God bless you.